It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our first guest today, Dr. Bryant Marchant, board-certified orthopedic surgeon from CHI Franciscan Orthopedic and Sports Medicine Associates. AC separation, that's the anterior cruciate?
No, that's the acromioclavicular joint in your shoulder.
Oh, that's
Cruciate's
ACL.
in the knee.
Okay.
Yeah, ACL knee. This is the AC joint, acromioclavicular joint in your shoulder. You irritate that, very painful.
All right, here's Dr. Marchant and Shannon O'Kelly.
Dr. Marchant, welcome to Health Talk. How you doing?
Thank you so much, Shannon. Great.
Good to have you here. We're going to talk about the acromioclavicular joint, otherwise known as the AC joint. But before we get into that topic, tell us about your practice. You're an orthopedic surgeon, kind of the area you focus in, maybe some training, some interest in your practice?
Sure. Well, I'm a sports medicine trained orthopedic surgeon, and I specialize in shoulder, hip, and knee injuries related to athletes and the weekend warriors among us who hurt ourselves doing the things we love to do.
We have a lot in common. I'm a physical therapist, and that's what we like to treat is shoulders, knees, and backs and necks and weekend warriors and stuff like that. Shoulders are a joint that's they're often injured more so than we think.
Correct. Roughly 10% of shoulder injuries are related to the acromioclavicular joint in the regular population. But among football players, hockey players, that incidence goes way up to 30% of NFL players' shoulder injuries are related to the AC joint.
Let's do some anatomy. Set us up the acromioclavicular joint, AC joint. Tell us about that joint.
Sure, that's the joint that connects the collarbone or the clavicle to the shoulder blade.
Or the scapula, or sometimes shoulder blade, scapula. And if you touch on your anterior shoulder and feel around, a lot of times you can feel that bony prominence there, AC joint. And it's connected by some interesting connective tissue, ligaments, and it's a pretty important joint in mobility and function.
Yes, quite a bit of rotation happens through the clavicle as we elevate our shoulder, and a lot of that is translated through the acromioclavicular joint. There are actually two ligaments that hold the clavicle down, and then there are two additional ligaments that keep the clavicle from shifting front to back against the the shoulder blade or the scapula.
The mechanics of the entire shoulder joint are fascinating. I mean, if you dive into the mechanics and the motion and what has to happen to raise your arm over your head, it's pretty incredible. The AC joint can be injured at times. Tell us about the trauma and the injury, the mechanism, and let's dig into that.
Sure. Usually injury to the AC joint occurs from a direct blow. Often that direct blow occurs from a fall, like you would see in football or skateboarding or anything that allows you to topple over.
You know, a lot of times if you watch it on TV, this is the typical scenario where the defensive lineman's coming in, the quarterback's rolling out, the defensive lineman wraps up the quarterback and lands on that shoulder and compresses that lateral shoulder, popping that AC joint, and then you traumatize that joint. And you guys, orthopedic surgeons, you guys like to grade things. Tell us about the injury and the grading of that joint, because I want to set it up because you don't always have to repair this, but there might be a need to repair it based on the grading.
Right. Fortunately, most of the time we don't have to do surgery on an AC joint injury. Grades 1 through 3 tend to be less displaced and less injury. Grades 1 and 2 almost never need surgery, usually a few weeks, and you can be back at it. With a grade 3 injury, a little bit of nuance in how we treat that. Most of those still treated non-operatively, but in elite athletes, laborers, sometimes it's good to do surgery on that. With grades 4 through 6, there's a lot more displacement, and all four of those ligaments that I mentioned earlier are usually disrupted, and so those usually require surgery.
This is the athlete or patient that you're going to see 4 through 6 that's going to present, and you're going to look at them and you can physically see the displacement. I mean, there is a bump, an obvious displacement, and a separation of that clavicle and acromion joints.
Absolutely. You'll see the footage. They'll walk off the field or the court with their arm just hanging down, and you can sometimes even see that prominence on the camera.
Yeah, and I use the word separation. I think it's important because a lot of people confuse a separation versus a dislocation. So maybe we owe it to the listeners to describe the separation as the AC joint that's separated. Dislocation is a totally different ballgame.
Sure, a dislocation involves a joint that is completely separated out of its natural position. And so those grades 4 through 6 would be, by definition, a dislocation of that AC joint, whereas 1 and 2, a sprain, and grade 3 is that gray area where your surgeon will decide with you what the best course of treatment is.
More with Dr. Bryant Marchant, board-certified orthopedic surgeon from CHI Franciscan Orthopedic and Sports Medicine Associates, right after we take this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
All right, we continue our conversation with Dr. Bryant Marchant, board-certified orthopedic surgeon from CHI Franciscan Orthopedic and Sports Medicine Associates. More information at chifranciscan.org. Shannon O'Kelly and Dr. Marchant talking about AC separation, and back to them.
Dr. Marchant, thanks again for joining us. And, I want to just give you a shout out, talking off air. You spent 25 years in the Army. Thank you for your service and your dedication to this great country. And, and being an orthopedic surgeon, we were talking, you did a lot of sports medicine with a lot of soldiers. Being a soldier is a movement type activity. So a lot of knowledge on your end.
Absolutely. They are elite athletes that we have to take care of. The 1st Special Forces Group and the 2nd Ranger Battalion were my teams.
Wow, that's amazing. So you've probably seen, we're talking about AC joint separation, you've probably seen these grades. We talked about grades in these 4 through 6. This is that separation where there's significant separation of the two joints, the clavicle from the acromion. It sometimes needs to be repaired. How do you repair that? Because there's some controversy out there.
There are. Historically, there was a technique called the Weaver-Dunn where you would transfer over the AC, the coracoacromial ligament, over to the end of the collarbone. The problem with that is it was only about 20% of the strength of the original ligament. So we've worked to develop new techniques to fix those injuries. And having seen dozens of these in my experience in the Army, the newer suspensory techniques with really high-strength suture and augmenting that suture repair with a tendon augmentation seems to have given us somewhat better results more recently. So lots of techniques described, screws, plates, but really we've moved more toward techniques that don't require hardware removal later on, which was one of the issues with those earlier techniques.
Why repair it? I mean, aside from the fact there is a deformity, an obvious deformity on that shoulder, repairing it, the need to repair it just to enhance the mechanics, eliminate arthritis, those kind of things?
Correct. Return to function in the immediate, within 6 to 8 weeks, you can get back to really start working on strength again. And, 4 to 6 months for a throwing athlete to get back to where he needs to be or she needs to be to do their play.
And so what you're trying to do, I mean, it's fascinating what you orthopedic surgeons do. You've got to take that joint and kind of assess the condition that it's in, but also look to the future, and then you have to fix it so it moves, because the AC joint has some rotation and some movement. I mean, there's necessary motion there, and you can't take that motion out of it because then you eliminate motion in the shoulders, so it's mechanical.
Right. Some of those earlier fixation techniques removed that rotation component, which is what required removal of the hardware later after the injury had healed. So we're pleased that we can do this now with just one technique for the most part.
So just as return to play activities, if I have a grade 1 to 3, you're looking about 6 to 8 weeks possibly?
For the grade 1 to 2, sometimes you can get back even within 2 to 3 weeks, depending on the severity. And then as the severity increases, it takes a little bit longer time. If you're a throwing athlete like a quarterback, it could even double your time to return to play, even with one of those lower grade injuries. With the higher grade 4 to 6s, you're looking at surgery, and even in some of the studies in NFL players, it takes about at least 2 months to return, if not longer if you're a throwing athlete.
The biggest issue is to return to play is you've got to have the strength, you have to have the mobility, you got to be able to protect yourself. That's a big issue.
Absolutely.
Thank you so much for your time, and again, thank you for your service, and thanks for joining us on Health Talk.
Absolutely. Thank you very much, Shannon.
All right, we're going to be back with our next guest coming up right after this on Como.